Morning, welcome back to Sports Massage Works. Today we're going to talk about manual lymphatic drainage massage and what that is. That we usually refer to that as MLD. So, what is lymph? It's a first place to start. So lymph is a fluid that flows through the lymphatic system, and the system is composed of lymph vessels and intervening lymph nodes whose function, like the venous system, is to return fluid from the tissues to the central circulation. So manual lymphatic drainage is extremely helpful, but it's a very relaxing technique that is used to move lymph manually in order to reduce odema, fibrosis as a result of injury. The aim is to help to relieve pain and tension, and is completely opposite to sports massage, where pressure is applied. This technique is so light that you can sometimes fall asleep during treatment, and some clients are likely to feel the lymph moving in various areas that's being worked on. When I've had feedback from my clients, a lot of this is reflective on the digestive system. So it really does help with digestion as well. So with the manual lymphatic drainage, there's a lot of metabolic waste that is being removed, bacteria, toxins, and excess water. It's good to help with odema, like I said before, in skin conditions or skin disorders, headaches, sinus congestion, sprains or aches, stress, digestive orders, as I said before, surgery, and scar tissue. It is advisable, though, that women who are menstruating do not undergo manual lymphatic drainage. Another note to consider, though, is if you are taking medication like antibiotics and are new to taking the medication, it's better to wait a day after the final course of medication is completed before having manual lymphatic drainage. They also recommend that if you don't have regular massages, then when you do your first manual lymphatic drainage massage, it's probably better to book a half-hour treatment. Like with anything, there's always a side effect, so it's better to just check, the usual tiredness, fatigue. You need to drink lots of water afterwards, so it's good to make sure that you are well enough to have this treatment, even like when you would with massage. But contraindications to this, so that means we can't treat you if you have an acute infection or disease or fever, active patients who have cancer and have an undiagnosed lump, malignant melanomas, serious circulatory problems, and major heart problems. Consent from the GP is required if you have diabetes or a removal of spleen, epilepsy, breast implants, organ transplants, or joint replacements. So those are the main areas that we would look to have consent from the doctor before treating. But each individual, again, responds differently to MLD treatment, and therefore it will be tailored to the individual accordingly, okay? So if you think that you would like to try out some manual lymphatic drainage, as I say, it's a very, very gentle and light technique, then do book yourself in and give it a go. Then we can see how you feel afterwards. Take care, and I'll speak to you soon.